hyperpigmentation and wrinkles. So basically, we want you to have a beautiful, even skin tone and no wrinkles whatsoever. So I'm going to run a quick poll just to see how many of you are new. So right now, if you would be so kind to answer if any of you have attended one of our masterclasses before, yes or no. So we can trickle in the answers and really curtail like what we're teaching to the audience. Oh my goodness. Wow. Wow. Okay, crazy. 45% of you are new. Okay. So welcome. We are so excited to host.
We are.
Let me just introduce myself. My name's Renee Bolin. I am a medical esthetician, and what I preach and what I'm obsessed with is all about this man. Okay, he is the man, the myth, the legend. This man, Dr. Dennis Gross, is a dermatological surgeon. Okay, he is a board-certified dermatologist who practices here in New York City on Fifth Avenue. He's seen over 120,000 patients, which is insane. He's also a published author. So tonight, we really want to give you the most education that you possibly can get and all of the tips and tricks that you need to learn about hyperpigmentation and wrinkles, correct?
You said it. And for 45% newcomers, we're going to pretend that we've never done this before, okay? And we're going to teach. Our whole thing is, our goal is to let you understand more about hyperpigmentation and wrinkles, and so that you understand, and then you can actually select the products that make the most sense for you, because they will get you results, and the more you know, the better off things will go. So we are not going to dumb it down. We really respect your interest and your ability to understand science, and we are going to really teach you so that we really enjoy this process of skincare, because it's exciting and fun. And
exactly. And we want to break it down for you guys in a regimen form. So when Dennis is actually giving you the knowledge about each ingredient and each product, I'm actually going to be demoing it so you see how it's used. One of the first things that we want to know is if you are experiencing any of the following things during aging. So you are having fine lines and wrinkles. You are having dullness of skin, which, in case you're not sure what that means, it kind of means when you wake up and you look in the mirror and you're like, ugh, I wish I had, like, I do not feel glowy. I don't feel vibrant. I don't feel, you're like, ugh, this is just bland. Uneven skin tone, which is pigmentation. Dry skin, which, you know, you can get those patches as well. Hyperpigmentation. Rough skin texture, so those bumps, or visible enlarged pores around your nose. All right, so Dennis, we got 21% fine lines and wrinkles, 13% dullness, 17% uneven skin, 7% dry skin, 23% hyperpigmentation, 6% rough texture, and 13% visible enlarged pores. So my first question to you then is, since we got such a high number for hyperpigmentation, I have so many people ask me, what is the difference between sun damage, so those brown spots that you see, but also melasma that you get if you're pregnant or on birth control? What is that?
The bottom line is not much, okay? Which is why one product can work on all the above. Because at the end of the day, what you're talking about is too much pigment, too much of this thing called melanin. It's almost as if you had, think about black ink against a wall that you took on a paintbrush and you splattered it. If you looked under the microscope, for all these conditions, you're going to still see these blotches of what looks like paint in the skin. The difference is that the cause varies. So for example, melasma. That's when you get patches of brown discoloration very much through here or on the upper lip, especially
on the lip. Yes.
Right. Now, those are
bad when you're taking birth control.
Exactly. So that's what melasma is. Melasma is when you get too much pigmentation because of hormonal problems mixed with sun very often. So what kind of hormonal problems? Pregnancy, birth control pills. Those are the things that, and sometimes medications can cause problems like that too. So always ask your doctor, does this medicine make me more sensitive to the sun? Then you have sunspots, right? Those are more like discrete circles on the spot, right, on the face. Now, the difference is that there's a little bit of difference. Those are tiny little growths. They look like piano keys in the skin, but they're also associated with increased pigmentation. So as long as the problem has the same origin, pigmentation, we're going to have solutions. But we're going to teach you, for example, melasma, you must wear sunscreen. If you have sunspots, your sunscreen's insufficient.
Which is harder to get off?
I'm not going to say, and it depends, you know, you can have a mild case and a severe case of anything, okay? But if you have hyperpigmentation, I want to tell you from the very beginning, you have to know that the sun makes dark spots darker, okay? It's like wearing a dark shirt in the sun versus a light shirt. You're going to feel more heat, more warmth in a darker shirt, which is why people wear lighter clothing in the sun, because the same thing goes for pigmentation. The sun will get more absorbed by discoloration, the darker skin, and it gets worse and worse and worse. Now, crazy myth is some people think going in the sun helps burn out that discoloration. Not true. The opposite, folks. Please, sunscreen.
And then also Eva was saying, what about like the dark spots on her cheeks from old blemishes? Is that, you know, pigmentation as well?
Completely. When you see discoloration, it's always pigmentation, okay? And remember the concept. It's the cause that matters. It's all going to come back down to the same thing. This kind of thing that looks like ink inside the skin, melanin, but in discoloration due to acne, you got to know that if that's your problem, we have a product that will help that. But you also want to treat and prevent acne because that's what triggers the whole thing. And sunscreen matters again, okay? So all the same cause, different things that contribute to those conditions though.
Okay, and speaking of which, I'm going to run another poll because this class is all about pigmentation, but also wrinkles. So we want to know how many of you, like, what's your main concern? Is it pigmentation? Is it wrinkles? Is it both? Or is it neither? Oh, wow. Okay, so we have a ton that say both. Great. Listen, we are going to tackle both tonight. I would say the majority is saying hyperpigmentation, which is interesting. We are going to go back to that. Okay, so Sonia said, does the color of your skin contribute to hyperpigmentation? It
does. Here's the thing, Sonia. Now, number one, darker skinned people, darker complected individuals, their skin is used to making more pigmentation, generally speaking. So it's very common to see areas of redness, areas of irritation come back as turning a browner discoloration. That's the way that skin type works, okay? The flip side is very fair-skinned people very often have a problem too, because when they get too much sun, because their skin is freaking out, their skin just cannot deal with the amount of damage and trauma the sun is producing. The skin makes pigment to protect your skin from the sun. Your skin gets overwhelmed and does something really sensible. It says, so much sun here, let me just pour out the pigment in any way I can. It comes out uneven, haphazard. So fair-skinned people get discoloration too. It happens to the entire spectrum of the human race. Again, a different personality. Sunscreen and sun do matter though to everybody.
Okay, so a couple things I want to point out. So Melissa, you're saying you have old acne scars. Is it called pigmentation? They're indented. Nope, we're going to get to that. But the people that are asking about rosacea after what Dennis just said, we are going to have another class on Thursday specifically for rosacea and sensitive skin. So please tune in. But right now, I want to jump right into products that I'm going to use and products that'll really help with pigmentation. I know someone asked about hormones playing a role in it and patches. Of course, we are going to get a deeper dive into that. So the first thing that I'm going to do is I'm going to cleanse my face, which is something that I do every morning and every night. I'm going to use the Hyaluronic Meltaway cleanser, which I have here. And I'm going to just massage it in my skin. Just so you guys know, hyaluronic acid is a key ingredient here, which holds 1,000 times its weight water. Also, there's aloe vera that soothes my skin. And Dennis, it is important to wash your face 2 times a day, correct?
Oh, 100%. Now, that's important because, especially if you're going to wear makeup, you got to get the makeup off because that causes free radicals and that causes collagen to break down. And that's the reason people get fine lines and wrinkles as they get older. It's not just hygiene, it's anti-aging, okay? The other thing is, in this type of weather, your skin does get a buildup, your pores get clogged. This is a cleanser that is called Meltaway Cleanser. The key thing about it is you don't need water. So you can do this on the go. Let's say in the middle of the day, you want to just do a quick cleanse because your skin's a little shiny, your skin feels a little gritty. It's an amazing product for you. The most important thing I want to say, though, is if your skin is thrown off balance and gets a little red, and lots of times scrubs and harsh cleansers can do that, that's a setup for getting discoloration, for hyperpigmentation. It's also inflammation is one of the causes of pigmentation disorders, of hyperpigmentation. This is a cleanser that won't do that. And for those of you who said that loss of radiance or dullness was your concern, we got that covered. Every product is going to bring back the radiance. This cleanser starts your day off just by getting back your radiance.
Wait, I've got 2 really important questions. One from Tammy, who said, marine cleanser on dry skin, absolutely, because it has hyaluronic acid that holds 1,000 times its weight in water. It's going to bind so much moisture to your skin. Even when you saw all the makeup come off, my skin is so soft right now and it's radiant. Like there's nothing sticky. There's nothing left over on your skin. And also, Jessica brought up a good point, Dennis. At Dr. Dennis Gross, can you talk about why ingredients in cleanser are important even though you wash it off?
Because it takes off some of your natural oils too. It can strip your skin. Now remember, your skin is very smart. It creates things that you need. You don't want your cleanser to take off the things you need, to disrupt what's called your moisture barrier, okay? So all of our cleansers, this one we have 2 others, they all do not need a toner, for example. They have a built-in astringent because that separate step I have found is one of the most important things that people throw their skin off balance, or those little granules that you get in scrubs. You don't want those either. Terrible, because they're scratching the skin, not cleaning it. And that's something that you have to understand. So yes, for all skin types, these are cleansers that work. And because they give you, for example, hyaluronic acid, they leave that on, but they also don't take off the essential things that are built into your skin's moisture barrier, and they remove your makeup, they clean your pores, and they give you a deep clean, and your skin's left in balance. Beautiful, beautiful radiance.
Yeah, but wait, you guys, I have to talk about scrubs for a minute because I used to love physical scrubs. Like, you know, the beady little greens or little pieces of like salt or whatever you thought you were rubbing them against your skin. And the second you rinse them off, you're like, oh my goodness, I feel like a soft baby butt. I had no idea that the fact that those greens were so like indented and prickly that they could ruin my entire moisture barrier. They could spread bacteria. They could break my broken capillaries and make them worse. I had no idea, you guys, about physical scrubs. I mean,
right.
No.
And one little thing that's really people watching out, microbiome, right? Your skin needs a certain amount of healthy bacteria, right? It's true of our colon. That's why we take probiotics. That's also something that you don't want to disrupt. So lots of times scrubs will do that, okay? You want to keep the skin with what it needs, what it makes, what you cherish, but you don't want to take that off, and you want to add those ingredients back to the skin that make it really, really healthy.
So, great to know about ingredients that will actually make the skin healthy and radiant without harming it. And one of those ingredients is part of my absolute favorite thing you've ever come up with, Dennis. And listen, this whole class is about pigmentation, but it's also about wrinkles. Dr. Gross, something that he's so famous for, he brings efficacious ingredients in your home for affordable prices, right? So it's results that you know is a practicing dermatologist is delivering to you in these ingredients. You're going to see what you want, but he also brings medical devices into your home. I'm not sure how many of you have seen our steamer or any of our other devices, but this I really feel has revolutionized the anti-aging game. Like what the results that you can get at home, especially you cannot go see your derm right now. You can't go see your esthetician. You can't go to your Medi Spa. Basically, Faceware Pro keeps Botox away. All right. That's what it is. LED light, red, blue, both of them together. Please, Dr. Gross, talk to me about the benefits with LED with wrinkles.
Okay, so here's the thing. What we also bring to you are technology that's used in my practice as a professional dermatologist, used by doctors around the country that are medical devices, FDA cleared, to do things that are revolutionary. This is a product that comes from the LED technology that's available to doctors' offices, but we now have created a mask you can do at home 3 minutes a day. What Renee's talking about is that red light that she now has on her skin. That is going to stimulate collagen, okay? Collagen, like we talked about melanin for discoloration, now we're talking about collagen for fine lines, wrinkles, laxity, crepey skin, it's the crinkle before the wrinkle phenomenon, jowls, creases, all because we're losing the fibers of our skin called collagen.
There are so many people saying that they are scared to use this at home. Wait, you guys, I'm sorry, but I have to just show you. This is my before picture. This was me 6 years ago. Okay, literally, I was 6 years younger then. Never had Botox, never had anything done. Met Dennis. He refused to inject me. He told me that I wasn't using the proper ingredients for my skin. It's 6 years later. He still has never injected me. And I've used LED and the peels. And I think I look so much younger now than I did. Also, my pigmentation, my hyperpigmentation I had then.
Right. And so the thing is, people think, well, this LED light, is it going to get me hyperpigmentation? Is it going to make my hyperpigmentation worse? It's not, because LED is not ultraviolet light. Ultraviolet light, sunlight, we talked about it, does. LED is a technology that actually the skin has receptors for, doorways, gateways, that lets in this light beam, and it stimulates your own collagen. If you have redness, okay, I just saw someone write in the fact that she said that, well, that's probably why my redness has gone away. I think it was Margaret who said that. Yes, that's true. LED will help the redness. There are people who have darker complected skin and who have redness and irritation because they have eczema. Their skin's really sensitive, okay? They're blessed with a lower chance of skin cancer, but by the way, they're more apt to get irritated. LED, the red light, gets rid of the redness. And in the blue thing, if you have any discoloration or you have either acne, the blue light kills bacteria, so your acne doesn't have an issue, okay? So this is a technology you can do at home, no downtime. The thing is, Renee, explain to them how important usage is.
Consistency is everything. It is so key. You have to be regimented with it. It's just like I always joke with everyone. I'm like, listen, no one wants to eat a salad every day. Okay. And you don't want to exercise, but if you want to lose weight, you suck it up and you do it. It's the same with your skincare. You have to wear this for 3 minutes a day. It's not that much when you think about it. And listen, I'm seeing your questions in here. Yes, Kathleen, it does work around the lines around your mouth. And yes, it can be used for all skin tones, all skin types, which is important because normally darker skin tones with hyperpigmentation can't use certain lasers because it can make that worse. That's not going to be the problem with this. So this is all about consistency. 3 minutes a day. It's a rechargeable device. You only have to make the investment one time. Also, you guys, just to let you know, during this class, we are going to be offering 15% off for, I think it's 48 hours, and it is 817 VIP 15 to receive your 15% off. Erica, yes, it's definitely unsanitary to share it with someone, your boyfriend, I saw in quotes, if you don't clean it in between, especially right now during COVID. But you can just take a little bit of cotton and alcohol and wipe it down, and then it's completely clean.
Right.
So you are A-okay. Yes,
and fine lines,
the fine lines will diminish.
Lines here, you're asking about that. It doesn't matter. Here's the thing. All lines are due to loss of collagen. All lines are due to the sun damage you got years ago. All lines are due to wear and tear. It runs in families. This is something that's going to build back your collagen, which is the root of all evil when it comes to fine lines and wrinkles, okay? And it's FDA cleared. We had to prove the fact that this worked to the Food and Drug Administration of the US government to protect you, the consumer, so that they know we're telling the truth. And that's why you see results in 2 weeks. You got to stay on it every single day, okay? And day by day by day, you will see improvement. Renee, tell them about the neck, please, because the neck and the face go together. It's not just here, it's here, right?
I always tell people, don't neglect the neck. And I always tell you to take a before picture of your entire face with no makeup in the bathroom. Do 3 minutes a day like this, and then flip it upside down, insert your chin in the mouthpiece, do 3 minutes a day like this, which deals with my breakouts under my chin, as well as collagen stimulation on my neck. And when you look at those before and afters, that's enough to keep you going, right?
And we're talking about neck. There's two things that happen to the neck. It helps both because both are due to loss of collagen. Some people have the lines going across, right? The tech neck thing is real. Our neck is bent like this. We're going to get those creases. They look like indentations. Collagen gets run down. This builds back your collagen. And then what runs in family is a looseness, a laxity that some people have. Some people have both. But that crepey texture, that loose texture, helps that too.
So basically, you're battling every problem that you could possibly have. So the whole thing with the LED is that you want to make sure that you use it on clean, dry skin. It's super important to make sure that you're using it with nothing beforehand, because you don't want to block anything, right, Dennis?
That's exactly right. It goes on first. Question about, what about my thyroid gland? Great. This person knows their anatomy. This is a skin procedure. This is a skin medically cleared device. It doesn't go deeper than the skin. So it builds your collagen, firms your skin, but it doesn't have anything to do with the vital structures and organs and glands below the skin. Don't worry.
Okay, great.
And it's safe for the eyes too, by the way. Notice we didn't even talk about goggles. You don't need to wear goggles. The FDA, again, said, yep, you proved your point. It builds collagen. Yes, it kills bacteria. Yes, it helps redness. But no, it does. You don't have to wear goggles because we designed it so bulbs are far away from the eyes. Yes, it gets the crow's feet. Yes, it gets the 11s. Okay, but your eyes, don't worry about it.
It's so funny. Katie B just said the LED mask will help with chickenpox scars then too, right? Katie, I have to say I've had 2 recent clients that I had one patient that had a chickenpox scar right here and one that had one like on her upper forehead. They're both gone from using the I don't know if we can.
Scars are, go ahead.
But it does definitely get rid of it.
Why? Because scars are loss of collagen. How about acne scars? Same thing. Whether it's a virus like the chickenpox that destroyed your collagen, or the acne that was so dramatic and radical that it destroyed those fibers, and what they both have in common, they give you valleys. Because why a valley? Because the collagen's gone, no more support. It builds your collagen, fine lines, wrinkles, laxity, jowls, creases, scars, all a collagen problem.
And Claudia, it definitely works on hands. One other question before I go into the RLP was from Francine. She wanted to know, she's had upper and lower jaw surgery. Is it okay to use if you have a lot of metal? I don't know. I have no idea.
No, everybody. I'm a dermatologist. We are a skincare brand. We're going to work on your skin. Okay, we're going to help you with your problems. We're going to find the root of the problem and then give you answers, because there's technology and science, and that's what we're about. We're a clinical, clean skincare brand. But below that, we don't go. So don't worry about metal and surgery. I'm sorry you've had that issue. But you know what? At least your skin can get the results you're looking for, and you don't have to worry about other things.
Okay. Well, back on to our regimen. I was looking through our polls to see if I had to run another one real quick, but I want to go into peels. So obviously I know that pretty much everyone in this class knows Dr. Gross is famous for his alpha beta peels. He's got his ultra gentle if you're super sensitive with rosacea, pregnancy, his universal if you have normal to combination skin, and his extra strength if you have oily skin. But tonight I'm going to go one step deeper because we are talking about pigmentation, and we wanted to bring up a really important ingredient, bromelain. So this is our resurfacing liquid peel. Basically, this product is the closest thing that you can purchase at home to having a service with me in the practice. And it is a 2-step peel that you can start out doing once a week and then maybe move up to 2 or 3 times. But really, this peel requires you to be your own esthetician at home. So it's important to know how to apply. There's 2 steps, as always, because Dennis always explains that every true peel has 2 steps. You're going to see one that says 1 and one that says 2. I always recommend prepping them before you go ahead and apply because it's so important. So you're going to receive 100% organic and sterilized cotton. I like to zhuzh it out, which is a very technical term. I zhuzh it. And then I like to turn it over 1, 2, 3. And then I move it over to the other spot 1, 2, 3. And then I do the same thing for step 2. Having them prepped ahead of time is so important to get the best case results that you want. Also, Dennis always talks about how important it is to use this cotton because this cotton is able to actually hold the correct amount. So after step 1, I'm going to do 1 swipe all over my entire face. And then I'm going to wait and see how I feel. If it's really tingly, I'm not going to do a second swipe. But if I wait 30 seconds and it's okay, I can do up to 3 swipes before I do step 2. Dennis, can you talk a little bit about bromelain for pigmentation and this product?
Okay, so first of all, I just want to say one thing. Notice this is another example of a product that's a treatment designed from the professional setting of my practice, okay? If we want to give you results, that's why we're here. And we know that doctors' offices like myself, we have technology that has not really been available to you at home. This is a 2-step treatment that you do once or twice a week. The rest of the week, use the alpha beta peel. That is a 2-step peel that's going to deliver the alpha and beta hydroxy acids plus an enzyme called bromelain, okay? Bromelain is an enzyme. It comes from pineapples. Now, anytime you can get an ingredient from nature, we're going to package it in such a way that's going to make it work even better, have a delivery system that works better, and it's going to help remove that top layer of dead, dull skin, give you that radiance we talked about first thing in this class, and then it's going to do 2 things that are relevant. Number 1, it's going to start to exfoliate and get into the skin and start to break down that pigmentation, okay? Plus the acids in the first step are going to help disintegrate them as well. Furthermore, these are ingredients that are going to help build your collagen. And you can't drink collagen, everybody. If you want that collagen to firm your skin and you put it everywhere, like notice she even did it on her upper lip because that's where people get melasma. That's where people get fine lines and wrinkles. Anywhere you see those things, this is a product that's going to help build back your fibers, okay? And that's why you get this firming effect. So pigmentation and anti-aging with collagen production, that's the beauty of the resurfacing liquid peel.
And there's a couple things that I want to mention. Like, one is the fact that, you know, bromelain actually dissolves dead skin cells to help fade the pigmentation. That's but right. Also, this is okay to use with your daily peel pads. I saw you in the chat saying, hey, can I use this? Absolutely. So I use this probably twice a week, and it's on days that I don't do the daily peel pads. Right. But you can absolutely incorporate it because it's going to take that deeper level away. And again, like I was talking about, being your own esthetician 1 to 3 times beforehand, and then you're going to want to wait that 2 minutes before you do step 2. But this is step 2. And Dennis, I think for me, the most important, people forget step 2.
No.
Okay. They don't do it. They don't know why they need to do it or why it's important.
Right. And it's very simple because there's no such thing as a one-step peel. All peels, look in the history books, Google this. Peels done by doctors are always 2 steps. You have your acid step, you let it do its thing, then you got to shut it off. That's how it's safe. That's what a neutralizer is designed to do. And I don't like acids that are left on the skin. Those are just super strong exfoliators that make your skin red and raw, and you do see flaking. You're not going to get that kind of result here. You don't need to damage the skin. The second step is your protector. Your second step is what allows you to do this at home, this idea of a professional treatment at home safely. Okay, so just follow instructions. She showed you how to load up the cotton balls, how to wait the 2 minutes. That second step is so important because it keeps your skin in balance, it keeps it gentle, and yet it makes it so effective.
And you guys can see my skin is so clean. It's so radiant. It's so shiny. But there are really big, important questions that I want to answer here.
What else are you using?
Yeah, there's so many that I want. Okay, can you follow up with extra strength peel pads? Or listen, you can do any alpha beta peel, Francine, is an alpha beta. Extra strength, ultra gentle, or universal. They're all alpha beta peels. You can absolutely use them in conjunction. You just want to use them on a separate day. Mickey, you said, can you use under the eye? Listen, you don't want to use anything. Dennis has taught me so much about how thin this skin is and how important this skin is around my eyes. So unless it says that it's specifically formulated for that area of my face, I'm not using it there, right? He's taught me how important that is.
You can use it. Here's the rule. If you feel bone, where you feel the bone around your eyes, that's where you can do your peels. Alpha beta peel, that's where you can put your resurfacing. But not in the socket, not where you feel the bone is gone. You can put our eye serums in that area, but not your peels, okay? Just follow instructions. You will see dramatic results, and that's how these products are designed.
Yeah. Okay, so that is the Resurfacing Liquid Peel. On to the next product that I want to talk about. And I want to highlight a couple ingredients about this because I want to talk about the IPL Dark Spot Correcting Serum. For me, I'm going to use this as a spot treatment before I use my actual serum. But this is amazing for pigmentation for 2 reasons. One is that it's as effective as 4% prescription strength hydroquinone, which is insane. But there's also no downside. There's no side effects. There's no flaking. Can you talk to me a little bit about how kojic acid is important and why that's a little bit different in your product here and how it prevents pigment from forming?
Let me start by saying this is the #1 product for people with hyperpigmentation. If that's why you're watching this show, I want you to know that this is the product that has changed people's lives because it is so effective. You will find that your skin looks better so fast because this has ingredients like vitamin C, which we know is an incredible, powerful ingredient from Mother Nature, delivered in a way that makes it really powerful, combined with what Renee just said, another ingredient called kojic acid, and another naturally occurring ingredient. Now, what is important to understand is that there is more than one reason you see hyperpigmentation, why you get those uneven skin tones, why you get those discolorations. You cannot just put in one ingredient and call it a day. You cannot just go into one layer of the skin, like the top layer, and say, that's all you need. Both are the difference in this product. We have multiple ingredients that are going to stop the overproduction of your pigmentation. Ingredients like kojic acid that are going to disintegrate the discoloration. ingredients that are going to prevent the transfer of the pigment from low down where it's made to the higher layers in the skin where you see it, okay? And then ingredients are going to stop that happening over and over again. So this is the IPL serum, okay? Simple to use. You can use it on your acne scars, the type that makes you discolored, not the valleys, a different type of scar, melasma, sunspots, anytime, anywhere you can use this. I recommend you use it at night for sure, and if you want to use it twice a day, you can. But this IPL serum, this is our claim to fame. This is what we're saying. You got to use this product. This is, if you want to get better, watch this work.
Yep. And the other thing that I love, I put on my bunny ears because people were like, where are your bunny ears, Renee? And Michelle's like, oh, I told her not to wear them because we're out of stock. So I put them on anyway. But the other thing that I want to point out about this product is that this is for every skin tone and skin type. The other thing that I love about this product is people who are having severe breakouts, this is not going to make you break out more. Or also people who have more melanin in their skin and have deeper, darker skin tones that are worried about pigment getting darker. Not going to happen. So to me, this is an actual gold mine for pigmentation.
And yes, you can use it with retinol. And I want you to understand something. All of our products are designed to be used together, okay? So if you're using retinol, of course you can use this product. You just have to layer it. And I want Renee, because she is the chief esthetician, she will explain to you about layering, but understand, you can't put retinol and vitamin C in the same bottle, but if you want both, when we're talking about retinol, you can use it.
And we're there are two different types of vitamin C right now, just so you guys know. Like, yes, Cleo, you can use it as a spot treatment because that's exactly how I just use it. Although people who have pigmentation all over, you can use it all over as well. That's the kind of product that it is. You decide how you want to use it. And yes, it's daily use, Tammy, and you can use it twice a day. All right, so in terms of layering, I'm actually going to layer 2 more products on top of it. And the reason that I want to talk about these is because of exactly what Dennis is saying. There are so many people that are like, all right, I know that retinol is important. I know that vitamin C is important. Give them to me. What am I supposed to buy that's going to give me both of them? They cannot be combined in one product because they react with each other. So you're not going to get the most efficacy. So one has to go on before the other. I apply the C+ collagen, which I'm not going to apply right now, in the daytime for pigmentation. But right now we're going to talk a little bit about retinol and ferulic. And this is the Overnight Serum, which has retinol that helps with cell turnover for pigment and also has niacinamide to restore my moisture barrier. So I'm going to take 1 pump of this, apply it all over. Dennis, please speak about retinol when it comes to pigment and also wrinkles.
Perfect. That's exactly where we're going to have to explain this. Here's what you need to understand. This is the educational point to retinol. So retinol comes from vitamin A, right? So we talk about the fact that if you have an ingredient that comes from something natural, like a vitamin, if you do a little science, it's a clinical skincare brand, that's what we are all about, that makes it work even better. What you find is you get your retinol product. Retinol is an ingredient that does 2 phenomenal things. It actually helps resurface the skin layer so that your fine lines and your wrinkles show a dramatic improvement. So if that's something you have and you want to improve it, you can use this product. The second thing is retinol also contributes to the improvement of uneven skin tones. So if you have a dual problem, some uneven skin tones, and you want to improve some wrinkles, this is a product you really should look at, okay? If your problem is strictly discoloration, the IPL serum is your better choice because that is going to really target the deeper, darker discoloration. This is a product that does really tackle the 2 camps that many of you have answered in the opening question, that you have wrinkles and you have uneven skin tones. You want to use both, you sure can do that too, okay? But retinol is quite an incredible thing. Renee asked about niacinamide. There are some ingredients that are going to make your skin radiant, that are going to do so many things to your skin that we had to include it. And that's part of what we do by design. We are going to put multiple ingredients in all our products because no one ingredient owns the highway. That's just the truth. And niacinamide is vitamin B3. I saw a question, it was Mickey who asked this question, explain the moisture barrier. And I saved that question.
Oh, I saw that.
Yeah. I want to answer it now. I didn't forget, okay? The moisture barrier is your skin's own natural protection and your own natural hydration, your own natural moisture barrier, okay? That is something that is not a perfect system. It's where it wears away. And at night, what happens is, especially your skin you're losing moisture. So this is an overnight serum that, thanks to niacinamide, has the power to regenerate your own moisture barrier. It's not just about giving you moisture, just like in the case where I said that you want to put collagen ingredients that build your collagen. You can't drink it. We always use ingredients that help your skin regenerate, rejuvenate, restore, okay? And supplement with other ingredients. Niacinamide builds back your moisture barrier, helps uneven skin tone, helps redness, okay? Is a super strong antioxidant which protects your collagen, right? Your collagen doesn't only wear away and become diminished, it also ages, and you need ingredients like antioxidants to preserve what you have. So niacinamide is a brilliant ingredient that's in this product too.
And after that, speaking of this, is I want to apply the Retinol and Ferulic anti-aging moisturizer, but Dennis, I didn't even know everything that was in this moisturizer until today.
Okay.
I've been working for you 4 years. Okay. I've been obsessed with this moisturizer 4 years. And I was like, why? I really asked, I was like, why does this help with pigmentation? What's in here? And someone like our main person from education today was like, oh, well, Dennis put in a complex. And I was like, well, what's the complex? And he was like, it's ellagic acid,
right?
Gallic acid, and also collagen amino acids,
right?
That helps to protect vital skin cells to firm and smooth the skin and be a barrier.
That's right. That's right.
I didn't even realize that that complex of those 3 acids was in here. I had no idea until today.
And what I love about that point is that people hear the word acid and sometimes they think, oh my God, that's going to strip my skin. It's going to be super strong exfoliator. Acids, by the way, your skin right now, if we took a pH meter and measured whether your skin right now is acidic or not, it is. That's how your skin lives, okay?
Yeah.
And one thing about the skin is whatever it is naturally, it likes more of the same, okay? So acids are friendly to the skin as long as you use 2 steps and you shut them down, as long as you use ellagic acid that's in this product. Naturally occurring acids, like that one, for example, that complex she's talking about, these are ingredients that are going to help your skin look more plump. And that's really important because not only do you need collagen to have a younger, smoother layer of skin, you need hydration inside the skin. That's what hyaluronic acid, ellagic acid does it too. Now notice the word acid keeps coming up. Hyaluronic acid, it's in your skin. What does it do? Holds 1,000 times its weight in water. You need ingredients like that. You want that ingredient. Vitamin C, what's that called? Ascorbic acid, okay? So acids and acids, these are all really safe and healthy things. And then we have ferulic acid. I can't underestimate that for you folks. As brilliant as retinol is, here's what it's not. Retinol is not an antioxidant. Ferulic acid protects your collagen. Ferulic acid makes sure that if you're on the sensitive side, yes, you can use this product, because ferulic acid takes away the irritation and redness, which that retinol has been notoriously known for being harsh. So here we have another acid that is in this product, and it doesn't throw your skin's pH off balance. It keeps the balance. So it's just an idea to understand that these ingredients add so much, and we don't talk about them. You're right, Renee.
We don't talk about the ones that you formulate with because people hear the big ingredients and that's what they think of. But there are so many other ones that are just as important that really help aid in the efficacy. Okay, Taryn, you said, is that moisturizer okay for oily skin? Absolutely. I love this moisturizer. Even people with acneic skin, I always am telling them to use our Ferulic and Retinol products because I think it really does help with pigmentation left over from acne, and they don't clog your pores at all. So
Right.
I think that's something that's super, super important.
But if you're oily and you're looking for a retinol product, I want you to know, I think the one we showed earlier, Renee, the Overnight Serum is probably your better bet, right? Because niacinamide does something I didn't mention. It helps regulate your own oil chemistry. So if your skin's making a little too much oil, go this one, okay? It's a lighter weight moisturizer that contains niacinamide.
And then one thing, Dennis, I know I'm going to throw you for a loop a little bit right now because it wasn't on our sheet and it's not on our handout that you guys are referencing, but he brought it up. And I do want to talk a little bit about hyperpigmentation and wrinkles around the eyes. And I know it's not something that we plan to discuss, Dennis, but I just want to talk about the Ferulic and Retinol triple correction eye serum, which is probably, just so you guys can see, it's a gel-like texture, and it's probably the only eye product that I know about on the market that's designed specifically for your lids as well as underneath to help firm this upper skin. Dennis, can we talk a little bit about like pigmentation and wrinkles around the eye area and why it's different?
This is an all-purpose eye product, okay? Because we've taken retinol, combined it with ferulic acid, made it gentle enough to have retinol used around the eyes, and that's going to accomplish a couple things. First of all, yes, you can use it on your lids, right? Lots of times people complain that their lids get heavy as they get older, this thing called hooding, and you know what? There's no laser for the upper lid. And by the way, you don't want a brow lift because that is a gory plastic surgical procedure.
But also, Dennis, I was just telling one of your patients, I was just having a consultation and they were talking about eye lifts. And I have to tell you, just like it's so important that you think about who you go to inject you with Botox, I saw two women in their 50s that had eye lifts for their 50th birthday, and it was awful. And they would it was not the same. They would have gone so much better with a product that would have just.
Not only, and how about when you're younger? People always ask me, well, what about prevention? What about the idea that here's the rule of thumb: the sooner you get to a problem, the better the better results you're going to get. So if you're seeing a little bit of laxity on your upper lid, definitely it's not going to get better on its own. Odds are it's going to get worse. This is a product that's really going to fortify the skin of your upper lid, and it's going to start to help prevent and treat that laxity, that looseness, that crepiness. Then notice Renee put it over through here because that's where you see crow's feet, the fine lines and wrinkles that we get this way, okay? Those are going to get deeper. Those are sun damage. The skin here is really thin. So what happens is it thins out even more because of sun. And by the way, wear large sunglasses, folks. Don't let the sun come in the side. Okay. And also, if you're squinting below your sunglasses, that wear and tear is aggravating those wrinkles. But this Ferulic and Retinol eye serum works to build collagen here. And then last thing, here's the amazing thing: dark under eye circles. Even if
you talk about
a little bit of it, it's going to help. It's going to help so much. So that's why I hate this word all-purpose, but it's multitasking, okay? There's so many different things. If one product can do multiple things, we are going to do it for you. This is a classic example of an eye product that has you covered for all the major problems people see. And if you have fine lines and wrinkles here, it's going to help you. If you have laxity here and looseness, it's going to help you. Multitasker.
And do you know what else is another multitasker that Dennis does better than anyone else? That's the peels. So in case, oh, wait, Carrie B just said something so funny. She's like, so my oversized Tom Ford sunglasses are skincare. Yes, Carrie, explain to your husband it's part of the dermatology bill. The oversized Tom Fords. I feel you. Okay, so this is a good question too. What about dark circles for people with darker skin?
Darker skinned people need the same treatment. Remember, human skin is human skin. What's the problem with darker discoloration? Melanin. It is the substance in the human race that makes skin darker. The same ingredients are going to help everybody. It's just a nuance. It's just that darker skinned people are lots of times, by the way, there's allergies. There's something called eczema, atopic dermatitis. If that's the problem you had like as a kid, you might have had rashing, you might have rubbed here. That comes back to haunt you, okay? But the bottom line is this is a balanced product. It's not going to irritate, and it's going to help discoloration, all skin tones, all skin types, because it has a common denominator, melanin, the single thing that goes wrong with everybody, okay?
All right, so couple questions we need to ask. We have to run a couple polls before the last product. First of all, we want to know, what time of year do you apply sunscreen? So that can be winter, spring, summer, or fall. And then we also, while you guys are answering that, we'll run this poll. How often do you apply sunscreen? Once a day, it's in my foundation, when I'm at the beach or at the pool, 2 to 4 times a day, or never. All right, so looks like from the first poll, we've got 21% saying winter, 26% saying spring, 29% saying summer, and 23% saying fall.
Pretty good.
So that's pretty equal for all seasons of skincare. For the next one, for how often are you applying it, we've got 65% saying once a day. We've got 22% saying 2 to 4 times, 3% saying never, 4% saying at the beach, or 7% saying it's in my foundation. So let's talk a little bit about SPF.
You bet. So here's some principles about sunscreen. As a dermatologist, first of all, I'm also a former skin cancer researcher. This is near and dear to my heart. And sun is going to age you, and sun's going to have negative health benefits to your skin, skin cancer, precancers. You don't want scars from that surgery. Let me tell you, sunscreen is essential for everybody who's watching because you all want better skin. Let me just tell you a couple things. Number one, you got to apply your sunscreen at least once a day. Now, if you're going to apply it and you're not going to perspire heavily, you're not going to go in the pool or the ocean, and you didn't have a bad day in terms of perspiring, it's probably fine to last all day. But if the next day you wake up and your skin's even remotely pink, you didn't do enough. Pink is the new red.
That's okay. Your new motto. We have to say,
is.
Dr. Dennis Gross, new motto. Everybody heard it here first.
Yep. And this is because I've been doing this a while, and I've seen a lot of people, and I've learned that you got to know that pink means you didn't get enough sunscreen. Okay, then you need to go up on your SPF or apply a little bit more. Then don't wait till you go outside to put it on. Put it on a few minutes before you go outdoors. Let it settle into your skin. Because, by the way, lots of my patients say, you know what, I got burned, I got discoloration because I put it on a half an hour after I go out. I didn't think I was going to stay out that long. I met my friend in the parking lot. We talked. I had some coffee, blah, blah, blah. It adds up. Put your sunscreen on. Don't go outdoors without it, okay? Last thing, when you put it on, okay, I'm seeing an epidemic of skin cancer and precancer here along the hairline, along the sides, on the ears, okay? You got to cover these areas. Yes, it's going to maybe totally. You got to put the tops of the ears. It's really, really important. And moms, dads, kids, same thing. Okay, especially if they come out of the water and you towel dry, sunscreen goes back on. You got to reapply.
All right. So basically, all right. So I'm taking a little of the Dark Spot Sun Defense, right? Rubbing it in my hands. So I'm applying it all over, as well as you would say my entire ear area. And what, you think you should go in the scalp?
No, you just get it. Just don't go like this. Go like this. And you don't have to mess up your hair. And by the way, if you mess up your hair a little bit, skin cancer prevention, fine lines and wrinkles. Go for it.
Okay. So now we're running another question to see how many times have you had a severe sunburn in your lifetime? You know what? I have to be honest, Dennis. One time, it was so bad where I actually I blistered.
Yeah.
I had on my back, it was almost like it was like boils. Like I had actual
tense blisters.
Yeah.
I hear you. And let me tell you something. Sunburning is the #1 risk factor for skin cancer. You're worse off if you get burnt than you are if you got tan on a regular basis. Getting your skin tanned on a regular basis does increase your risk of skin cancer, definitely will cause fine lines and wrinkles. But burning, those kind of blasts where your skin gets red and blistered, that's really dangerous. And careful with the kids again, okay? And
Dennis, what should people be looking for? Because 33% of our viewers said that they have had severe sunburn 3 or more times in their life.
Okay.
What should you be looking for?
I'm going to say this quick because I don't want to run out of time, and I want you to hear this. Okay. #1, don't do it again. Okay. You have been through the limit. That's enough. Stop it. Sunscreen, don't burn again. Okay. #2, when we talk about ingredients, I want you to understand that you need to use ingredients that have antioxidants in them. Antioxidants are going to prevent the damage that you got from those burns years ago, are going to prevent the negative effects they're going to have years later. The sunburns you got years ago, it's not over and done with. They last and they cause damage later. Vitamin C, incredible ingredient to think about using, okay? Then if you have alpha and beta hydroxy acids, that's going to help regenerate your collagen because that's going to get destroyed. We talked about retinol, another great ingredient. You need to think about anti-aging products applied directly to the skin, okay? And then you have to know that your skin is probably more vulnerable to hyperpigmentation. Your skin is probably more prone to more burning as a result, okay? Because your skin only has so much reserve. So please be careful, learn from that. And then we have an SPF, this dark spot defense. I really highly recommend this product because it has a physical block in it, okay?
And can you talk a little bit about the difference between physical and chemical really quick? I know we're running out of time.
We are a clean skincare brand. What does that mean? It means that we're going to select only those ingredients that have pure, no controversy in terms of having only the positive effects and none of the things like parabens and phthalates and sulfates. All those things. We're also vegan and cruelty-free, by the way. But the thing is, physical sunscreens.
And also, Susan, non-comedogenic. So yes, all of our products are okay for acne-prone skin. Keep going.
So here's the thing. Physical blocks are unlike chemical blocks. Listen to that word, chemical sunscreens get into your bloodstream. You put them on your skin. The Food and Drug Administration, this is not my opinion, this is fact, has proven that it gets into your bloodstream at 200 times normal levels after one application, okay? And they've also said it's been associated, read it again, Google it, a couple months ago came out. This now has been shown to cause hormonal problems, internal diseases. Again, kids have issues with it. Physical blocks are the only blocks we use. We've been using it for years because I never liked chemical sunscreens. Physical blocks, this is something that they do not get into your circulation. They do not go inside your body and get into your other organs, okay? Chemical sunscreens. All right, you guys,
key thing to point out just again, really quickly before we sign off tonight, if you're buying sunscreen for yourself, your children, even if it's not our brand, we don't care. Just make sure you're looking for the ingredients zinc and titanium dioxide. That's what's safe. That's what's not going into the bloodstream. So for your kids, for whoever, those are the ingredients you're looking at. We don't want any of those long, ugly words. I hope you guys really enjoyed tonight. Thank you so much for tuning in on pigmentation. Dennis, again, thank you so much for offering up all of your knowledge and being available for us tonight. We appreciate you and love you. And our fans, thank you so much. You guys, I'm going to miss you. I'll see you all next week when I'm back from vacation. Thank you for my happy vacation.
Yes, enjoy, relax. And thank you, Renee. You do great things for our people too. They love you. We do too. Thanks.
All right. See you guys soon.